One of the things that may be unique is if you had a C-section, then there's going to be the question of not only are you dealing with a new baby, but you have to heal your C-section. And so what's that going to be like? Well, the C-section is a major abdominal operation. You are cut open into the abdominal cavity, the baby's removed, and you're sewn back up. And so there's some healing that goes along with that. And it can really take up to 6 weeks before you're really kind of getting back on track. So don't be surprised by that. Having a newborn baby around while you're healing from your C-section just makes it even that much more difficult because you're being deprived of sleep and you have the stress of a new baby. So don't be surprised if you do have pain from your C-section. In fact, you'd be surprised if you didn't. The doctor will likely give you pain medicine to go home with, usually a narcotic such as Percocet or Vicodin, and then often an anti-inflammatory like ibuprofen. And what I tell my patients is they really serve sort of separate, different purposes. When you really have bad pain, that's when you want to use a narcotic, and you don't really want to skimp on it. I mean, you don't want to totally snow yourself, but you don't want to be in horrible pain either. When you don't have quite as much pain, but you need something to take the edge off, that's where the ibuprofen can really come in handy. And if your pain is really through the roof, you can take both at the same time. That would be safe. The narcotic has a lot of side effects. It can cause constipation, it can kind of make you feel loopy or even tired, and you're already pretty tired from having a newborn baby. So the sooner you can get off the narcotic, the less side effects you'll have. Usually by about 2 weeks, most people have weaned themselves off the narcotic medicine and are mostly using ibuprofen. The ibuprofen has a lot less side effects. It won't cause constipation. It doesn't make you sleepy. And so it's sort of a better medicine once it's adequate to relieve your pain. You'll notice that each day you're going to feel a little bit better and a little bit stronger. One day you're going to feel really good and you'll overdo it, and you're probably going to pay for it for the next day or two. Don't be panicked. You haven't done any damage. This is pretty common and happens to most people. The incision, it's going to depend on what type of closure they did. Some doctors will put staples in, and those will need to be removed either when you leave the hospital or you'll need to go back to the doctor's office to have them removed. Often we'll put something called steri-strips, which looks like a little Scotch tape, and those can fall off on their own as fine. If not, I tell my patients that it's okay to take them off in about a week, but whatever your doctor tells you or how you feel comfortable. Some patients don't feel comfortable touching them, and for those patients, they come in and I take them off for them. Either way is okay. It's okay to get your incision wet. In fact, it's important to get it wet and soapy every day in the shower and get it clean to get the bacteria off the skin, because that will help decrease the risk of an infection. However, once you get out of the shower, you want to keep it really dry because bacteria love warm, wet areas. So you don't want to leave the incision wet for long periods of time. It's totally fine to get it wet in the shower, but you want to keep it dry when you're not in the shower. That's actually very important. You want to keep an eye on the incision. Make sure it's not turning red, that it doesn't get really tender to the touch, doesn't feel hot to the touch, or pus comes out. Any of those things you really need to be seen right away because you're probably developing a wound infection. And the treatment for that is fairly simple if you catch it early, but can be a little bit more complex if it gets a little bit too far out of hand. If you get a high fever, you certainly want to call your doctor and be seen for that. I'd recommend holding off on any major exercise until you're at least 6 weeks out. First of all, you want to let the incision heal, but second of all, you really want to be spending most of your energy taking care of your baby. But by 6 weeks, you should be able to start back up to your normal exercise routine and do most of your normal things. So that's the sort of the differences that you can expect with the C-section. Every now and then I have a patient come in and they're really surprised that they hurt. I say, of course you hurt. I took a knife and sliced you open. That's going to hurt. But it does get better, and each day you're going to feel a little bit better and a little bit stronger. And don't worry, you will get back to your old self again.
Medtwice.com